Good evening, and thanks for joining us for this virtual town hall about pregnancy and the COVID vaccines. My name is Tammy Sander, and I work for the Hamilton County Health Department. I'm joined tonight by a panel of health experts from the Hamilton County Health Department, as well as 3 Hamilton County doctors, 2 OBGYNs, and a pediatrician. We'll start the night by explaining the latest vaccination statistics for Hamilton County and how they're affecting the county's COVID positivity. We'll explain why pregnant women are more vulnerable to severe illness and hospitalization from COVID, even death. We'll tackle some tough questions around the vaccines, specifically concerns about the potential long-term side effects for both mom and baby, issues like fertility, miscarriage, and risks of prematurity. We'll talk about the benefits of vaccination for baby and for those who haven't been vaccinated yet. We'll walk you through each of the vaccines and how to best register for a shot. We'll also take questions after we get through with our presentations. So just look for that Q&A box at the top of your screen. We'll try to answer as many of those questions as we have time for tonight. Let me start by introducing tonight's panel. Dr. Carolyn Rouse is the Medical Director of Labor and Delivery and Co-Director of the OB-ICU at Riley Children's Health. She is a graduate from the IU School of Medicine. Dr. Rouse completed her obstetrics and gynecology residency at the University of Washington School of Medicine, followed by her maternal fetal medicine fellowship at Brigham and Women's Hospital in Boston. She joined the IU Maternal Fetal Medicine Division in September of 2017. Dr. Maria Schmall is a maternal fetal medicine physician at Riley Children's Hospital. She received her bachelor's degree in nutritional sciences from South Dakota State University and her medical degree from the University of South Dakota, and completed her residency as well as her maternal fetal medicine fellowship at IU. And finally, Dr. Evan Reitzer is a board-certified pediatrician and fellow of the American Academy of Pediatrics. He practices primary care at Ascension St. Vincent Fishers Pediatrics. Dr. Kreitzer has a passion for preventative care, mental health, and working with vulnerable populations. He is also the father of 2 young children. And Jason Leemaster has worked in the field of public health for 28 years, the last 25 with the Hamilton County Health Department. He is our administrator and sets the marching orders within our department. I'm going to turn it over now to Jason to provide us with the latest COVID numbers and to look at how Hamilton County fares in its efforts to get its residents vaccinated. Jason.
Thank you, Tammy. Appreciate the time. Yeah, as we've been seeing and we've been hearing, the numbers of positive cases in COVID, have been increasing recently across the state of Indiana, across the country, across the state, and as well as Hamilton County. We have seen those trends. This is one of the graphs that's kind of available out on some state sites. So you can kind of see our numbers that have been kind of going up with the Delta variants that we've had around. Yeah, and actually this is some great information. Actually, out on the State Department of Health's coronavirus.in.gov site is where this information can be found, and this actually happens to be the advisory level map. It's usually updated on Wednesdays and with information, so we run a little bit behind as data has been catching up to it. Unfortunately, that we've seen this week from the state is a lot more counties this week have gone to kind of the red, very high transmission rate. Fortunately, if there is a fortunate, Hamilton County has been able to stay in the orange level. I'd like to think that the same thing, our vaccination rates are high in the county, so we tend to see our numbers slowly trending behind what the other state has. Oh, thank you. And actually, this number's even jumped up a few more since this week. We increased by around 1,000 or so every day. Right now, we're up to almost 233 or 34,000 of residents of Hamilton County that are fully vaccinated. And what that means by that eligible population that's fully vaccinated is they're either 2 weeks past receiving their second dose of a 2-dose series, or their 2 weeks after a 1-dose series shot. With that, when we kind of look at those numbers, it's very good because Hamilton County tends to have lead the state very high. I haven't looked myself exactly where 72% is got us at in the state, but it is one of the highest in the county for being fully vaccinated.
So while we're talking statistics and percentages, it's worth noting that only a third of pregnant women are currently vaccinated against COVID-19, which is of grave concern to healthcare providers because pregnant women have a twofold risk of admission into intensive care and a 70% increased risk of death. In fact, 90% of pregnant women hospitalized with severe COVID-19 in the past year are not vaccinated. So let's bring in Doctors Rouse and Schmall. Good evening, ladies.
Hello.
Why aren't we seeing more pregnant women getting vaccinated?
I think that there is a lot of different types of information out there and a lot of misinformation out there. Pregnant women are just trying to do the best that they can for themselves and their babies. And it can be really difficult to wade through all of the different misinformation that is available. So we're really hoping that today we can provide some good, strong, solid, evidence-based recommendations that people can use to help guide their decision-making around receiving the COVID vaccines.
Dr. Schmall, what are some of the reasons you're hearing for why women are putting off their vaccinations?
Most women are nervous about it being relatively new and most of the studies not being done in pregnant women. And so a little bit of the uncertainty. Some women are also nervous about how their friends have responded to the vaccine in terms of, that moment in time where they don't feel well. But mostly, like Dr. Rouse said, it's really wanting to do the best for their baby and the uncertainty of the vaccine, especially with its rapid development.
Yeah, well, you both obviously feel strongly about the vaccine and getting more expectant moms vaccinated, or you wouldn't be here tonight. I would love for you to both share your own personal stories. Dr. Schmall, I know that you are definitely practicing what you preach.
Yeah, I have currently a 6-month-old baby and received my vaccine shortly after the vaccine was approved in December. I didn't delay for any reason, knowing that vaccines are really well studied in pregnancy. And even though this was still new, the safety profile was definitely there. And so I had no hesitation on getting that vaccine.
Dr. Rouse, you're an aunt. You've got 2 new babies in the family. Can you share your sister's journeys and whether or not they were reluctant to get the vaccine?
Sure. So I have 2 sisters, both of whom were pregnant over the last year. One of whom received the COVID vaccine while she was pregnant, and the other who received the COVID vaccine during the period of time when she was undergoing fertility treatments in order to become pregnant. I think they both had the usual questions that pregnant people and people who are considering becoming pregnant have. Is it safe? Is it going to affect my pregnancy? Is it going to affect my ability to become pregnant? But we went through the data. We went through the answers that are out there through studies of really hundreds of thousands of women at this point. And they both decided that it was the best and safest thing for each of them to receive the vaccine.
Dr. Kreitzer, I'm going to put you on the spot because you've got proof. The proof is in the pudding right there in your hands. Let's see what you got. Yeah, let's unmute you real quick and tell us about your wife's experience.
Absolutely. Hi, can you hear me? There we go. I had to mute because this is my 3-month-old, and that's what, when I'm in the office and people ask me about vaccinating their children, or when I see pregnant women, they mostly want to know what do we do as doctors? It's easy to say one thing, but what do we actually do in the end? And so I talk about my children. This is my 3-month-old, beautiful, happy, healthy little girl. And this is what you get when you vaccinate during pregnancy. My wife, also a healthcare provider, was vaccinated while pregnant, and she delivered us a beautiful, healthy girl, and she's continued to remain healthy as my wife has breastfed her. So this is the result of vaccination. That's what we like to say.
Beautiful. Thank you for sharing her with us tonight. So clearly unvaccinated pregnant women are more prone to adverse effects of COVID-19. Dr. Rouse, why is that?
I don't think we know exactly why pregnant people are more at risk. Certainly the immune system of those who are pregnant is different from the immune system of those who are not pregnant. But we definitely know, as you have alluded to in the prior slides, that there are increased risks in pregnancy when you are infected with COVID.
So let's walk through that a little bit. Why don't you talk to us about the increased risk for severe illness and what you're seeing here locally? Is this really happening here locally? I mean, we hear these stories from out of state, out of town, but is it happening here in Indy?
It's really happening. We are seeing pregnant patients get admitted and they are sick. We know there's an increased risk of ICU admission, of ventilation, needing to be intubated, increased risk of needing to deliver early, increased risk of death. So these are definitely things that in our practice we are seeing, and it is heartbreaking, honestly.
Yeah, Dr. Schmall, let's talk about that a little bit. The ICU admissions. Who are these women who end up in this condition? Do they have pre-existing conditions? Were they otherwise unhealthy? Who are these women?
Yeah, when we looked at COVID, especially when it first started, a lot of our very sick people were often elderly with comorbidities such as diabetes, hypertension, other things that put them at risk. But in our pregnant women, they're outside of pregnancy, there doesn't seem to be a common association. A lot of these women are healthy otherwise, outside of just being pregnant. And really the only common feature between all of them is unvaccination. It truly is the only thing that links them all together, that and pregnancy.
Dr. Rouse, what about the risks of preterm or stillborn deaths?
So because of the potential for developing critical illness or very serious illness, which is higher when you are pregnant, oftentimes we are forced to deliver those patients earlier than we would otherwise have in order to optimize their medical management. So there's about a 60% increased risk of preterm birth in COVID infection in pregnancy, and we know that prematurity can be associated with things like developmental and physical disabilities, prolonged neonatal intensive care unit stays, even neonatal death.
Well, that's the perfect transition, because the next slide we were going to talk about that a little bit. So as long as baby survives, yeah, what's the big deal if it comes a little early?
Well, the things that you have on the slide. So prematurity is a really broad term and can certainly encompass the things that we see here. So preterm babies have trouble with breathing that often requires respiratory support. They can have heart problems requiring medications to support their blood pressure or keep their blood pressure down. They're at a higher risk of having brain hemorrhage or bleeding within the brain, which can then lead to things like intellectual and developmental disabilities as well as death.
Dr. Schmall, what other pregnancy complications can COVID create?
Outside of the complications that we see from ICU admissions, intubation, respiratory complications, we are seeing higher rates of complications such as DVTs or blood clots, higher rates of preeclampsia, especially when we see it a little bit earlier in pregnancy. We used to not see an association between things like babies growing small or growth restriction, but as more data comes out, we are starting to see that a little bit more frequently, and that maybe COVID does increase that risk for complications specific to pregnancy.
I know for HIPAA reasons, we can't just speak and tell stories, but in general, can you share kind of some of the stories that you've seen, patients you've treated, outcomes from not having been vaccinated and coming down sick with COVID while you're pregnant?
I think Dr. Rouse hit on this. earlier, and that what we're seeing, especially in the last 6 months, is that it's heartbreaking. I've never seen this many women in the ICU for one common reason. Never have seen so many women get sick so quickly. And it really does leave you with a large ache in your heart, both for these babies and for the moms and for the families. Because even if moms do survive, they are delivering their babies early, sometimes not meeting their babies till later in life, and really missing vital parts of their babies' early days, weeks, and sometimes months.
Dr. Rouse, do you care to add to that?
Yeah, I think one thing that we also alluded to earlier is the increased risk of stillbirth. And as obstetricians, there are a few things that are more awful to diagnose than the death of a baby while still inside the mother. And we know that there is an increased risk of stillbirth in pregnancies where there is a COVID infection. And it's so difficult to have to give that diagnosis and know in the back of your mind that this was potentially preventable. The best way that we know to prevent COVID infection is with vaccination. And so it's really, really hard. It's hard for us, and it's obviously devastating for those families.
Yeah, let's take a look at this statistic here. This is from the Centers for Disease Control and Prevention. Tens of thousands of pregnant women have contracted COVID since the pandemic began. Nearly 20%, or 1 in 5 of those women, were admitted to the hospital. And a couple hundred have even died, many, like you mentioned, without ever getting the chance to meet their unborn children. Dr. Rouse, talk about the kind of toll that takes on, it puts on a family, on a doctor, on the nursing staff. Heartbreaking, I think, is what Dr. Schmall said. It really is quite awful to think about.
Yeah, we go into this field of obstetrics and are hoping for good outcomes for families and moms and babies, and then to have to watch as a pregnant or postpartum person really suffers the ravages of COVID and is never able to meet the baby that they had to deliver because of this COVID infection is just so hard. And my heart goes out to those families, and I just feel it's so challenging and just absolutely devastating. And then you're right, for the healthcare providers too, to watch this happening is just continues to be really, really hard.
So Dr. Schmall, if the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, and the American Academy of Pediatrics are all encouraging pregnant women to get vaccinated, why are we still struggling with so much reluctance? And how do we get past it?
Yeah, I think it still comes back to, as we alluded to earlier, misinformation, the uncertainty of it, the newness of it. COVID we're coming up on 2 years, so it's still relatively new. And I still remember almost exactly a year ago when the vaccine was approved. So it's still new and it's still fresh, and we don't have years of information. And I think that makes moms nervous when they're worrying about themselves and their babies, because they want to do everything that they can. And I think to overcome that is really just education, getting the correct information out there and helping it spread. So just informing one person who tells their friend can really make a difference. And doing our best to, within reason, give stories of why we recommend this and what we're trying to avoid, because we want all our moms to go home with their babies healthy and happy.
Well, Dr. Rouse, let's talk about some of those common questions. You hear a lot of people who worry about the speed at which the mRNA vaccines were developed, but these really have been in the making for a long time, correct?
That's right. So even though COVID is relatively new, vaccine technology is not new. And so applying, the COVID-specific proteins to this technology was really kind of fortuitous and lucky that we had all of these years of research and development into vaccines generally, to be able to have these scientists then take this spike protein and hook it up to these vaccines is really quite amazing. So even though it seems as though it was developed overnight, there's been years and years of development, in fact.
Dr. Small, can the COVID vaccine make someone sick or give them COVID?
The COVID vaccine will not give you COVID. It is not the vaccine that is, or I'm sorry, not the virus that is in the vaccine. It's a part of the vaccine that our body recognizes so that we can fight it when we are exposed to the real virus. It may make you feel not well in the realm of, some muscle aches. Some people have low-grade temperatures and headaches. This is very short-lived, 18 to 24 hours at most, and you recover quite well. I got my booster shot last week. I was up and running the next day with no complications.
That's great. Dr. Rouse, what about long-term health problems for unborn babies? Is that a valid concern?
So while these vaccines have only been in existence for about a year now, information that we have from other vaccines like the flu vaccine and the Tdap vaccine, they work very similar to this, which is you get the vaccine into your body makes antibodies. You don't get the actual COVID virus into your body with the vaccines, but those antibodies can cross the placenta. So contrary to, the concern about causing long-term health problems, getting the vaccine can actually be protective for your baby, both keeping you healthy and safe during pregnancy, and then even that baby potentially having antibodies after the birth.
I know as moms, we tend to think of everybody else first. We think of the kids first. And I think that's natural as a newly expectant mom to worry about the unborn baby. But without taking care of yourself, there is no baby, right? I mean, you kind of have to take care of yourself.
That's right.
So what about the chances of miscarrying after getting the vaccine? We've heard some people claim that the vaccine caused them to miscarry. What do we know about that?
I think there's a lot. This is one of the areas that has a lot of misinformation in terms of causing a miscarriage. With the data we have even over the last year, there is no difference in fertility, and infertility does include recurrent miscarriages, and we're not seeing that at all with the vaccine. And people are very easily continuing their pregnancy without complications after receiving the vaccine.
All right, Dr. Small, what about the potential for the vaccine to cause infertility, not just in women, but in men, people who are trying to conceive? Is that likely to happen?
No. Again, this is both from misinformation, I think, that gets portrayed over the internet and other sources, which has not been proven, has not been panned out, and has really no evidence to support this in any way. And we're seeing quite the opposite in that it has zero effects on fertility.
So Dr. Small, what happens if you get pregnant between your first and second doses of the vaccine? Do you go ahead and get the second?
Yes, we do not want you to delay your vaccine if you find out you're pregnant. We definitely want to see you as providers and give you excellent prenatal care, but don't delay your vaccine for any reason.
Same go for the boosters?
Same for the boosters too.
All right, Dr. Rouse, a lot of pregnant moms are waiting to get vaccinated until after their pregnancy. How big a risk are they taking in doing that?
Well, they're taking the risk that they contract COVID during the pregnancy, which has all of the risks that we've been talking about through this town hall. So we certainly encourage pregnant people to get the vaccine while they're still pregnant.
I mean, you're even administering the vaccine on the postpartum floor, right? Women who just refuse to take it during pregnancy, just that important to get it into them just as soon as they deliver?
Yes, for patients who choose to delay receiving the vaccine until postpartum, we have it available right immediately postpartum for them to help get them protected as fast as possible.
There's been a lot of discussion around natural immunity. If an expectant mom has already had COVID and recovered, does she still need to get the COVID vaccine? Dr. Small, I'll throw that your way.
Yeah. All societies are recommending that you still get the vaccine. We are seeing a lot of benefits with the vaccine in preventing COVID and preventing severe COVID, even with a history of having COVID in the past and having that natural immunity. And there was a thought of waiting 90 days after your initial COVID diagnosis, but that is not the case anymore, and are recommending people get the COVID vaccine as soon as they can.
Oh, that's great. And at what point in the pregnancy is the best time to get that vaccine? Does an expectant mom have to wait until after the first trimester?
No. We recommend getting the vaccine at any point during pregnancy when she's willing to get it.
Probably, you guys did mention flu too, and it is flu season, so it's probably worth mentioning that you can get both of those shots at the exact same time, correct?
Yes.
Dr. Kreitzer, we're going to pull you in here now. Let's talk about the benefits of the vaccine for baby. Recent reports have shown that pregnant women who received a COVID-19 vaccine not only built antibodies for themselves, but that antibodies were also found in the umbilical cord blood. I have to imagine that's good.
Absolutely. That means that the baby has antibodies, and that's what we want. It means the baby is born with protection against COVID. Moreover, what's interesting, if you look at women who actually are infected with COVID during pregnancy, and you compare them to women who got the vaccine instead during pregnancy, the babies of the women who got the vaccine actually have more antibodies, higher levels of protection than people that had the infection. So it's great protection, and one of the main reasons we recommend that women get vaccinated.
That's fascinating. The National Institutes of Health said that antibody protection could last 6 months or more for the baby. Does breastfeeding help provide any more protection?
It does. We're very fortunate that COVID is not spread in breast milk, but antibodies against COVID are spread. We know that breastfeeding promotes good health in so many ways. Babies who are breastfed in general have fewer ear infections, less pneumonia, lower likelihood of being hospitalized the first year of life. And now we know that it can protect against COVID if the mother is vaccinated. So all the more reason we want moms to succeed in breastfeeding.
So what if mom gets sick with COVID, even after she's been vaccinated? What are the chances she's going to make the baby sick? And is there anything she can do to protect the infant?
Yeah, the main thing is that if mom's breastfeeding, we don't want her to stop breastfeeding just because she gets sick. We take some extra precautions, wash hands carefully, make sure you're wearing a mask while you're breastfeeding, and socially distance when you're not breastfeeding, which is a really hard thing to tell a new mom. But we still want you to breastfeed, and frankly, that is the best thing you can do to protect your child. Otherwise, it's the things you've heard. It's get vaccinated, socially distance, wear a mask.
How important is it for other members of the family, beyond just mom, to be vaccinated when you're bringing a new baby into the house?
It's a great question. You know, I talk about that every year at flu season, right? You can't get a vaccine for the flu until you're at least 6 months old. So the way we protect babies is we cocoon them. We surround them with vaccinated people so they're less likely to bring flu, less likely to bring COVID into the house. So it's key that everyone gets vaccinated at the home, including grandparents, aunts and uncles, babysitters. Really, everyone that can get it needs to get it to protect our young and vulnerable children.
So we now know that the FDA has approved the Pfizer vaccine, at least for kids 5 to 11. Any idea when we might be seeing a vaccine approved for kids younger than that?
Oh gosh, we hope it's soon. The most recent news we're hearing is that the data will be collected here in the next 3 weeks. And so we'll be waiting on approval, which should just take a matter of weeks. So sometime maybe January, February. And you met briefly my 3-month-old here on my lap earlier. We also have a 2-year-old at home, and I'll tell you that both of my children will be online the very first day they can get the vaccine. We believe in it as pediatricians, and I personally believe in it. It's so important that we get not just our pregnant mothers, but our children all vaccinated. And that's the other thing I'll mention is, you know, we as pediatricians, children are our patients, right? The kid that comes before me in the exam room, that's the kid I'm taking care of. But in reality, we're also taking care of a family. The family unit is responsible for how the kid does, how the kid functions in life and succeeds. And so we really care about the well-being of the whole family and want to see that everyone is vaccinated.
Well said. So let's talk about the vaccine options, because there's a few options out there. Dr. Rouse, I want you to kind of run through this slide, if you will, because I know that you've got some definite opinions on maybe which ones you would recommend for a pregnant woman. Can you walk us through that?
Sure. So as most people know, the Pfizer and Moderna vaccines are 2 vaccine series, 21 days apart, with protection conferred 14 days after the second dose. The Johnson & Johnson vaccine is a single dose where you get protection 14 days after that dose. I generally, to my patients, have been recommending Pfizer and Moderna, mostly because they have higher levels of efficacy, higher levels of protection against the virus. We're also recommending boosters for pregnant and postpartum patients who previously received the full vaccine series. And again, we have those available in our office, but I know that at the end of this town hall, you'll give information about where people can get these vaccines.
Yeah, so let's pull Jason back into this conversation. Jason, tell us the best way to get a vaccine. Obviously, like Dr. Rouse said, you could start with your OBGYN, but there are a lot of clinics now available in our area. What's the best way to find one and get an appointment?
Well, Tammy, I'll also have to say in our conversation this evening that I appreciate listening to all this, as our physicians see different levels of people and vaccine uptake. You know, some get it early, some get it midway through, and some are getting it after, just as they gain more information. And so that is great that they're consulting with their physicians. And one of the best ways to get an appointment, if you're deciding to get an appointment, if you're not able to get it maybe through your physician or pediatrician's office at this time, is you can go to the rshot.in.gov website, or you can call 211, and they can help walk you through and get you arranged with a location that's in your area. Usually it's kind of zip code based, and they will try to find you multiple locations. Many of these locations as well, including ours, will take some walk-ins. Sometimes they're limited, sometimes set times just because of the management side of vaccines. And actually, this is a great slide. This actually shows that the larger map of Indiana. You can see some differences in the colorations. There are some sites out there that are specific to a certain type of vaccine. There are, when you kind of get into the blues, those are the multi-vaccines type. So they're giving, you know, Moderna, they're giving Pfizer, they might be giving Johnson & Johnson. And then recently they've added a little pin that you see there at the very bottom. And those sites also have the pediatric Pfizer vaccines in there. I'm happy to say that actually our Hamilton County Health Department site is one of 78 locations in Hamilton County that people can get a vaccine. And I think at last check, there were 1,421 vaccination sites across the state of Indiana, besides all the other mobile clinics that are popping up. So people that would like to make that choice to get vaccinated, to get boosted, they can go, as well as some of those that are on those maps in the other colors. I think they were gray on the dots. There's also a retail pharmacy locations where they can receive it. CVS, Kroger, Walmart, Myers. But however, instead of the RShot site, some of these sites will have their own specific website. And I apologize, it might be like cvs.com. If you just type in your Google search Meijer, Walgreens, Walmart, CVS vaccination, it can help get you to your local CVS, and you can get signed on through some of their more private sites.
Jason, you work out of the mass vaccine clinic at the 4-H Fairgrounds in Noblesville, which, by the way, offers all 4 of the vaccines that are currently available. Tell us about the process. Is it pretty quick and easy?
Well, I would say it's pretty quick and easy. The best thing to do is to get that appointment, and then you will get a link usually forwarded to you by email or text message. And that link has the second part of the registration process that you kind of need to do, kind of adding some of the questions on and things like that we need. That helps speed up the process. When you get to your site, usually inside, it's about a 10-minute or so process. And then, like you said, actually we cover all 4 vaccinations. So in check-in, sometimes our line might look a little bit big in the beginning part, but the line gets spread out by 4. We send our pediatrics to one side of the facility, and then adults go over to another side, and they're taken care of. So the process is really fast.
Dr. Rouse, what kind of side effects might someone experience after the vaccine?
So pregnant and postpartum people can have the same side effects as those who aren't pregnant. So common things include pain at the site of injection or some redness where the vaccine was injected. A lot of people experience some fatigue, so just being more tired than usual, as well as headaches. Some people can get a low-grade fever or, feel kind of like they're fighting off a virus, chills, joint pain, muscle pain. When you're pregnant, taking something like Tylenol can be helpful when you're fighting those symptoms. But the good thing is that those side effects from the vaccine are short-lived and self-limited. So they should go away after 12 or 24 hours for most folks.
So no reason to be alarmed if you have any of these side effects. They're short-lived and should take care of themselves.
Yes.
Dr. Schmall, can you tell us what your experience was being vaccinated while pregnant? Did you have any side effects?
The first shot I felt great. The second one I did feel I had some of these smaller side effects. I had a headache the next day and felt really tired, more tired than normal for a pregnancy. And then after that, after 24 hours, I felt completely normal, with a little bit of soreness in my arm that maybe lasted to day 2.
All right. I say, Jason, in the event that someone should actually have a severe side effect, why don't you tell them a little bit about VSafe and Vares and how that all works? Let's start with VSafe.
Yeah, VSafe is a great connection into the Vares system. VSafe is really a vaccination health checker that was developed from the CDC and the FDA to help make it more publicly accessible to load into what's called the Vares system, or the Vaccine Adverse Event Reporting System, which is a national system that's designed, again, to look for adverse events, basically learning about vaccination. The one thing about the Vares system of data, so all this data that is being collected into the Vares system, it's not designed to detect if a vaccine actually caused an adverse event, but what it can do is it can identify if there's any unusual or unexpected patterns that are being reported out there. A lot of that is comparison into what we've seen in the clinical trials, and any of those unusual or unexpected patterns will be investigated. They will ask more information. You might get some more text messages or some more emails, and they're trying to look at those vaccines so that we make sure that our vaccines are safe.
Fantastic. Thank you, Jason, Drs. Rouse, Schmall, Kreitzer. We'll open it now for questions. Please look for the tab at the top of your page. We're going to try to get as many as we can. If you don't have time to get to yours tonight, you can always reach out to us directly at any of our social media platforms, our website. We're always here to help. Let's start. Let's see here. Is it okay to take painkillers before or after the vaccine? Dr. Schmall or Dr. Rouse?
Yes. You can take it before, you can take it after. You could also just take to see if you have any symptoms from it. And it's not so much the pain. What you're trying to fight is those that headache, that possible low-grade fever that may develop for that short period of time. And Tylenol is safe to take in pregnancy. We tend to advise against using something like ibuprofen in pregnancy, but it's safe to take in the postpartum period.
We talked about this off camera before this evening, but Dr. Rouse, I think it was you who said that the vaccine doesn't actually cross into the placenta. Is that true?
That's right. So the vaccine doesn't cross the placenta, but the antibodies that the pregnant woman's body makes do cross through the placenta. And so as we were talking about earlier, that's how those antibodies get into the babies while they're still in utero.
We have someone who's asking if COVID positive pregnant women can get the monoclonal antibodies or any of these early treatments that some of the folks have been able to get in the hospitals.
Yes, we are recommending consideration of monoclonal antibodies for pregnant patients. They are most effective and recommended to be given early on in infection, so within 7 or 10 days. And they work to hopefully prevent the more severe consequences of infection, like hospitalization and intubation.
We're approaching the holiday season. We're already seeing our numbers spiking after Thanksgiving. Any recommendations that you might have for expectant moms who are planning to attend social gatherings or family gatherings?
I never want to tell anybody to avoid seeing their families because that's an important part of life. But doing it in a wise and smart way is important as well. We hit on it earlier. Having your whole family vaccinated is really important in terms of preventing that infection and protecting that whole family unit. And so I would just encourage, if you're going to gather, keep those gatherings small and intimate, and then encourage all those attending to be vaccinated if they can be.
Again, we have another question about natural immunity. Perhaps they missed that part earlier. They got on late, but let's talk about natural immunity. A lot of people say, my body knows what to do. It can handle this. So is natural immunity enough for an expectant mother?
We don't think that it is. There is some protection that comes from actual COVID infection, but we know that the immunity from vaccination is actually stronger. And so we certainly recommend vaccination even for people who have had COVID before.
All right. What are you seeing in terms of breakthrough cases? Is that happening? I have to imagine there's some percentage of that happening because we know that this vaccine isn't 100% effective. So are those women faring better if they've been vaccinated and do end up with COVID?
We are seeing breakthrough cases, both in pregnant, non-pregnant patients. But I think the point I make most often is that in those that are vaccinated are not getting very sick. It's usually mild, very short-lived, and they're recovering without any significant complications. So even if you do get COVID after vaccination, the outcome and your response is much better compared to those who are not vaccinated.
Dr. Kreitzer, here's a question more specific to you. If children experience less effect from COVID or don't typically get as sick, then why bother getting them vaccinated?
It's a great question, and it's true, right? The highest risk populations are pregnant women, people over the age of 65, people with pre-existing health conditions. But children are at risk too, and sadly, almost 1,000 children have passed away from COVID in our country over the last 2 years. And it's one of the top 10 causes of death. We vaccinate against a whole host of other illnesses that are far less likely to cause severe illness and death, and we don't think twice about it. So we're huge proponents of it. You know, no one wants to roll the dice with their children and take that chance of getting COVID. And frankly, as a parent, I'm much more worried about COVID and the actual infection from the virus than the vaccine. This is the best studied vaccine we have probably in the history of humankind. It's been given to hundreds of millions of people, and it is exceedingly safe. And that goes for children too. So for me, I'd much rather have my children vaccinated than take the chance of them getting COVID. And I guess that's the last thing to say is that this eventually will be something that either everyone gets infected with COVID or has been vaccinated. This is not really going to spare anyone. It might be another year or two, but we're all going to be exposed to this eventually.
Drs. Rouse and Schmall, we've got a question about allergies to the vaccine. Do you know of any specific allergies that mothers might need to be aware of?
Oof, I am not 100% sure if you have certain allergies to something. We know that people who have anaphylaxis are monitored for longer periods of time after they receive the vaccine, but that's not a contraindication to getting the vaccine.
Okay, Jason, we're getting a lot of questions about.
And I'll step in, of course,
yes.
as a pediatrician. Yeah. So in general, unless you have a known allergy to a component in the vaccine or reacted to the vaccine itself, allergies to foods and other vaccines are not a contraindication to getting the vaccine.
Jason, I'm going to throw it back to you again to talk about Vares. A lot of people are getting their information there. Tell us why that can't be a really great source of information.
Well, then actually even going to the Vares website is great because it even talks about what its strengths are and what its limitations are. This is public data, and so the Vares reports is kind of subject to what's put into it. And often some of those Vares reports lack information, they lack details, and they contain errors. That's why if the CDC and FDA, who is monitoring and working, runs the Vares program, if they see anomalies or suspected things, they will look into it and they will reach out and they will contact and they will verify the information. Actually, even talking in the office today, they have hundreds of different reactions that are out there that could be seen. And I even likened it to, you could go in and put multiple reports in, so you could actually create errors in it. So you have to be very careful with it. And like I said, they even say, even on their website, you cannot use the data to determine rates of adverse effects with it. So what they do is, again, they're going to look for the CDC, the FDA. They're going to look for any unusual, unexpected patterns. And a lot of that comes with comparison to what we've seen in the clinical trials. And if things stand out from that, then we're going to investigate it. One of the things, sorry, I don't know, talking a little long here, but one of the things that we even saw early on in our epidemiological work in the very first months of COVID, as we were making contacts with patients and positive cases and trying to find out close contacts, which now has become known as contact tracing. We do that in public health. Is we started seeing that first and early patterns of lack of loss of taste and smell. And we started noticing that. We actually even talked about that in the office. And it was about a week and a half later that we saw the actual epidemiological survey that we were doing. That was included as one of the symptoms that people were having, besides the high fever and those kinds of things. So that's what kind of Vares does with reporting. So people will report up those kinds of issues, not only with the disease, but something, or maybe some kind of reaction that they've had.
And Vares works, right? It just needs to be vetted a little bit. That's how we know about myocarditis. That's how we know about blood clots.
Yes, things like that. Start unusual patterns or unexpected things will kind of start to pop up. They will investigate those and then further take those under review.
Here's a question someone's asking. I've wondered myself. We've seen the numbers spiking again. They're getting, we saw a report today that they're as high as they were 11 months ago. So if we've got 72% of our population vaccinated, why aren't we getting closer to normal? Why are our numbers going up again?
Well, it's one of the things that I know is also being reported, and actually the Indiana COVID dashboard is starting to reflect that. It's starting to also see some reinfections, and now they've identified reinfections as a new positive test, I believe 90 days after a positive test has occurred. So they identify that as a new case. So starting to see some reinfections occur and those kinds of things. It's not just a new infection and those kinds of things. So we're seeing numbers go up, and that it's also that time of year. I think you mentioned it earlier as well. We're going indoors. We're more in close contact. And as we've seen this last week, we just went through a nice holiday where there were lots of families together, lots of tight groups. So that's sort of not necessarily a surprise to see some of our numbers starting to spike this week as well.
Any of the doctors want to add to that?
I'll speak up. This is Dr. Kreitzer. I'll just say 72% is a great number, but it's not herd immunity. So we fully expect that people will still be getting sick. It speaks to the contagiousness of this virus. But the majority of people who are getting gravely ill are unvaccinated. You know, it's okay if you're vaccinated and you get it and you have a little bit of a cold. That's tolerable. It's the severity of the illness we see in the unvaccinated that I think is most disturbing. And the other thing to consider is, what would this be like if 72% of people were not vaccinated? I mean, we're already struggling to care for people in some hospitals around the country. We would be completely overwhelmed by now.
That's a great point. And I think it's also worth noting that when we give that number, the 72%, that's of the eligible residents. So only those who are 5 and older. So that number used to be as high as 84%. Then we open it up to kids 5 to 11, and that number drops again. So it's kind of a number that we're chasing. And right now, not everybody is even eligible for a vaccine at this point.
Right. And as a pediatrician, we're seeing more and more children affected. So I know this is about pregnant moms tonight, but I'll have to throw that in there as well.
Are you at all concerned about an individual with an autoimmune disease getting the vaccine?
Go ahead, Carrie.
Yeah, I'm concerned about an individual with autoimmune disease getting COVID. So I do strongly recommend that even if you have an autoimmune disease, especially if you have an autoimmune disease, that you strongly consider getting vaccinated.
Dr. Schmall, you would concur?
Concur.
What if you delayed getting the second dose of Moderna? Is it okay to now get the second dose?
Yeah. Even if you delayed it by a couple months, you still need to get that second dose.
All right, we're getting close to an hour. I want to give you all time to leave us with some closing thoughts. Dr. Kreitzer, let me start with you. What would you like to leave people with this evening?
I mentioned earlier that as a pediatrician, our patient's not just the child in front of us, but the family unit. And very sadly, 170,000 children have been left without a parent or a guardian. Sorry, I should rephrase that. 170,000 children in our country have lost a parent or a primary caregiver to COVID. It's heartbreaking. We see increased rates of depression and anxiety amongst older kids. And we see already moms that aren't able to be there to be with their newborns and their young children. And so for us, while we want our children vaccinated, we want our moms and our dads and family members vaccinated just as much. So we just beg everyone in our practice, please protect yourself and your family.
Dr. Schmall?
Yeah, I often talk with my patients. My goal is to always, like I said before, have a mom and a baby go home together. And my job as their provider is to give them the best information about how to achieve that. And sometimes that's going to their appointments and doing routine care. But the thing that they can do is get that vaccine and really prevent that severe illness, those complications that we see from women who are infected with COVID, with that goal.
All right, and Dr. Rouse.
Yeah, I could not have said it better myself. I totally agree with everything Dr. Schmall said. COVID is real, it is dangerous. We are seeing it every day, and it is devastating. And the best, most effective way that we have to prevent those horrible outcomes of maternal death, stillbirth, all the other complications is to get vaccinated. So like Dr. Kreitzer said, we are begging you, please help protect yourselves and your families and get the vaccine.
Well, thank you all again for joining us tonight. We encourage you to reach out to your family physician or your OB or your pediatrician and ask the questions. It's okay to have questions, and they're more than happy to answer them. So please take the time to reach out to them. We're also here to help. Feel free to reach out to us if you have any questions. We just appreciate you taking the time to join us tonight, to listen and to learn. And if you'd like to share this information with family and friends, maybe they weren't able to make it on tonight, we will put a link on our social media accounts in the morning with a recording of tonight's presentation. Thank you again for joining us and have a great night.